In the case of Angola, the expertise we are mainly needed is really having a clinical toxicologist, especially if we talk about signs and symptoms, description of signs and symptoms, and turn them into an idea of what chemicals could have caused these signs and symptoms. And in Angola, we brought also an environmental expert in because we did some environmental surveys. So we went into the communities, we looked there what kind of chemicals are being used in agriculture. We even looked at illegal drugs and these kind of things. Another expertise we need are then environmental epidemiologists. So in the case of Angola, we brought that in through our Afro office. But the interesting part of chemical emergencies is that it's the expertise which is needed is not necessarily in the Ministry of Health. So even if you go in a country and the expertise is there, you expect the expertise to be there. It's not always the case that you find them with the Ministry of Health. Maybe a clinical toxicologist, maybe poison centers, which are linked to the ministries of health. But you might well find environmental laboratories within the Ministry of Environment, or maybe occupational health experts, which are with the Ministry of Labor. When you're dealing with pesticides, you might find the expertise in Ministry of Agriculture. But also some for civil protection, you might also find expertise there. So in the case of chemical emergencies, a rapid response team should search for expertise also beyond the Ministry of Health.